You are officially invited. Yes, you're invited to join us in Fertility Awareness Mastery Live. This is my 8-week group coaching program designed to help you gain confidence using fertility awareness. Whether you're actively avoiding pregnancy or looking to optimize your cycles for conception, we have a spot for you. We start the first week of May. Are you ready to jump in? Head over to fertilityfriday.com/fam to register today. That's fertilityfriday.com/FAM. This is the Fertility Friday podcast, episode number 356. Welcome to the Fertility Friday podcast, your source for information about the fertility awareness method and all things fertility. I'm your host, Lisa Hendrickson-Jack. I'm the author of The Fifth Vital Sign and the Fertility Awareness Mastery Charting Journal. I'm a certified fertility awareness educator and holistic reproductive health practitioner with nearly 20 years of experience teaching women to connect to their fifth vital sign through menstrual cycle charting, balancing hormonal health, and optimizing the menstrual cycle without hormones. I'm outspoken about hormonal birth control and its impact on fertility and overall health because you have the right to know how your body works and how artificial hormones disrupt that natural process. I host live coaching programs to help you achieve optimal fertility and health because it's important to have healthy menstrual cycles regardless of whether or not you want to have babies. I'm also a wife and mother of 2 beautiful boys. I know, I'm a busy girl, but I managed to fit it all in. This podcast is designed to empower you to take full control of your cycles, your fertility, and your overall health. And I'm so excited that you're here with us today. Today's topic is an extremely important one. In today's episode, we are talking about bleeding disorders. And this is the first time that this topic has been covered on the podcast. And in today's episode, we really get into, what bleeding disorders are, what are the most common ones, how they affect women specifically, and how they obviously could affect menstrual bleeding, menstrual cycle, and even during pregnancy, labor. The implications of an undiagnosed bleeding disorder, obviously very dangerous in those types of situations. And we also talk about some of the challenges that women face having the screening done, having bleeding disorders identified, and how we can really make sure that if that is something that you're struggling with, that you're getting the correct diagnosis. So in today's episode, I'm joined by 2 guests, Fiona Bethea and Jhon Velasco. So I'll just go through their background information real quick here. Dr. Fiona Bethea is a health scientist on the bleeding disorders team at the Epidemiology and Surveillance Branch of the Division of Blood Disorders, Centers for Disease Control and Prevention, CDC. Since 2016, she has worked with community partners to develop evidence-based health promotion and education programs to reduce and prevent complications of bleeding disorders. She also collaborates in the monitoring and evaluation of the Community Counts Bleeding Disorders Surveillance Program. Dr. Bethea has been privileged to serve this community and contribute to the scientific evidence base to help prevent and reduce complications of bleeding disorders. She received her PhD in epidemiology at Georgia State University, and she also has a Bachelor of Science in Neuroscience and Behavioral Biology. And now Jhon Velasco. Jhon is the manager of education and training at National Hemophilia Foundation, where he focuses on women with bleeding disorders, the Spanish-speaking community, and mental health. He earned his master's in health education from Columbia University, where he focused on health education, focusing on marginalized communities. A consistent theme in his career has been the development, implementation, and analysis of new and existing public health projects for a variety of international communities, specifically underserved populations. And a common theme among these projects is his commitment to working with individuals and groups to improve their lives through education, mentorship, and empowerment. Jhon is also a certified yoga and meditation instructor, having practiced through the Americas, Europe, and Southeast Asia. And so together, Jhon and Fiona have a wealth of information, specifically in the area of women and bleeding disorders and how bleeding disorders are affecting women. So without further ado, let's jump into today's episode with Jhon and Fiona. And I'm excited to be here today with Fiona and Jhon. They are here to talk about bleeding disorders. And as we were all talking about in the pre-chat before we hit record, this is a topic that I've never talked about on the podcast before. And so I'm really excited to dive into it. It seems kind of strange in retrospect that we haven't talked about it yet, given that menstrual bleeding is such a huge part of the menstrual cycle. So without further ado, welcome to the show, Fiona and Jhon.
Thanks for having us, Lisa.
Yeah, thank you. It's really an honor. Really looking forward to it.
Oh, I'm so excited to have you. And so what we can do is I'd love to give each of you an opportunity to share just a little bit about yourself and what drew you to this, because even we were talking and you mentioned, a lot of women and healthcare practitioners in the field don't even know a lot about bleeding disorders. So then, of course, comes the question, like, how did you get involved? So either can jump in first.
So my name is Fiona Bethea, and I am an epidemiologist with the Centers for Disease Control and Prevention, CDC. I have been working with the bleeding disorders community for over 10 years now in various capacities. I work with health communication, so our surveillance programs, research, and our cooperative agreements with community-based organizations like the National Hemophilia Foundation. And we have been doing a lot of work to raise awareness about women with bleeding disorders.
Mm-hmm. Thank you.
Yeah, and thank you. It's such a pleasure to be here. My name is Jhon, and I am a senior manager of education and training at the National Hemophilia Foundation. And my background, very similar to Fiona's, is based in public health. I started back in the 90s doing HIV work, especially in a time where, HIV wasn't, just how we see it now and how we treat it now, and just the taboos were a lot more. And my journey has traveled me through different parts of public health. And when I saw this opportunity to work with the National Hemophilia Foundation, it kind of brought my career back in full circle, going back to working with people who are really in need of more education and more awareness. So I'm excited to be here. I'm really excited to talk to you about the Better You Know campaign and just some of this great work that's happening. And, with the support of you and other organizations and folks, we can really make great strides for all communities dealing with bleeding disorders.
Well, with that said, let's just jump right into it. So I'd love to start with just, what is or what are bleeding disorders, and specifically, how would they show up in terms of a woman's menstrual cycle? How would she know? It's a big question. It's a loaded question, so I'll just pass it over to you.
So there's a lot in there. So your blood contains a lot of proteins and platelets that work together to form a clot, and that clot is what kind of helps you stop bleeding. So as you mentioned, bleeding disorders are a group of conditions where the blood just doesn't clot properly. And the type of bleeding disorder that a woman or girl might have depends on what protein is missing, or it just doesn't work the way that it should, or your body's just not making enough of it. So when a woman or girl has a bleeding disorder, it's not that they're going to hemorrhage out with every cut, but that clot's really just not going to form. So there's kind of a slow leak that takes longer to heal. So they bleed more and for longer than a person who doesn't have a bleeding disorder. Although sometimes with trauma, this can lead to very heavy, very hard to stop bleeding. So you asked about kind of the menstrual cycle. And heavy menstrual bleeding is actually the most common symptom of a bleeding disorder. Now, bleeding disorders aren't, of course, the only cause of heavy menstrual bleeding, but it is the most common symptom. So normally with menstrual bleeding, I'm sure you're aware, it's a natural normal occurrence for women. It usually lasts 4 to 5 days, comes about every 28 days. And the amount of blood loss is usually small, 2 to 3 tablespoons. But for a woman who has a bleeding disorder, that endothelial lining that sheds, that just keeps bleeding because those clots aren't forming the way that they should. So signs of heavy menstrual bleeding include having to change your pad or tampon every hour for several hours, or waking up in the middle of the night to change it. If you have to wear a tampon and a pad to prevent bleeding onto your clothes, flooding or gushing that really limits daily activities, work, school, exercise, spending time with friends. If your period lasts more than 7 days, 10 days is too long. If you have blood clots that are the size of grapes or strawberries, all of these are signs of heavy menstrual bleeding that can be a sign of a bleeding disorder. Now, there's other signs of bleeding disorders that I do want to mention too. If you have frequent nosebleeds or bleedings from cuts that lasts more than 10 minutes, easy bruising, like you just kind of brush up against something and you get a large flat bruise, or you don't know even why you got that bruise. Heavy bleeding or hemorrhaging after childbirth or miscarriage. That can be the first time that women are actually diagnosed with a bleeding disorder, is going through that very traumatizing experience. A history of muscle or joint bleeding. And then if you have heavy bleeding after surgery or outpatient procedure. So you had some dental work done and you're bleeding days later and you call your dentist and they say, no, you shouldn't be bleeding still. All of these are signs and symptoms of bleeding disorders in women and girls. And I think one more thing to just throw in there, bleeding disorders are actually inherited, which means that your mom or dad, it gets passed down to you. So you're born with it, and it's something that you actually have your whole life, even though most women don't get diagnosed until they start having their menstrual cycle.
Okay, there's a lot in there. I was taking notes. I know about all you were listening. I was taking notes though. So I have a couple of follow-up questions based on what you said. So there's a few things that you mentioned, the definition of heavy menstrual bleeding, things like that. So one of the things that I found, and I'm sure that you've gone through all of this as well, in the research is that I think the kind of 80 milliliters of bleeding during the course of a woman's menstrual cycle is kind of a line that a lot of researchers put in the sand. And if you're bleeding more than that, certainly if you're bleeding, as you mentioned, every hour you have to change your pad or tampon, that's certainly a sign. I remember reading some papers where the researchers didn't always agree, and some researchers suggested that even if a woman was bleeding more than 60 milliliters during the course of her menstrual cycle, they would define that as heavy. So one of the questions then that kind of comes out of that is, what would be some of the signs that a woman would have a bleeding disorder over, say, other potential causes of that? For example, fibroids or uterine polyps or like endometriosis. Maybe you could speak to what types of screening would take place to kind of rule out maybe some other potential causes of the bleeding.
One of the great things that we have with the Better You Know campaign is a menstrual chart. And it's a validated chart that was developed from OBGYNs and the CDC. And it really helps you. I mean, you mentioned this before we started talking, but tracking your period is just really, really important. There's a lot of, the period is something that feels very personal. Like we talk about our cramping and our PMS with our girlfriends, but we don't really talk about the amount of blood loss that we have. And when you first start your period, you talk to your mom or you talk to your grandma or your aunt. But if they're telling you, oh, no, we're just heavy bleeders in our family, this is just how it is for us. If you have a bleeding disorder, like I mentioned, that's inherited, which means your mom could have it. You could actually be part of generations of women who've been misdiagnosed. So the first step is really charting your period. We definitely recommend the Better You Know menstrual chart because it is validated. So Jhon, do you want to explain how it works?
Yeah, absolutely. And what we're going to be talking, so much stuff around here, and it's very complicated sometimes because it's new information. And the Better You Know site that we have, betteryouKnow.org, has some great resources. And what's also really neat about it is that it's in both actually in English and Spanish. So we're trying to reach as many community members as much as possible. So Fiona mentioned about the menstrual chart, and this is one of the charts, one of the education materials that we have that really helps you track how much bleeding you're experiencing during your period and for how long, and it also gives it a score. So this is really good because it empowers women and empowers folks to actually create a chart and look at it. And then when they go to their doctor or their providers, they can actually say, hey, here's the evidence, this is my history. So just to give you an example, we give it a score depending on how you're menstruating. So if your scores over the course of your period is more than 100, you likely are experiencing heavy menstrual bleeding and should see a healthcare provider. So it tracks the size and the length also of your pads and your tampons and how heavy the flow is and for how long. So this chart is a really good tool for people to have. It's also available in a PDF form, so you can just download it and print it out and use it to keep your your awareness about yourself and also to help your doctors understand.
Oh, I was just going to add that dialogue is really important to be able to, where they have something concrete that they can see about how much you're actually bleeding.
Well, so you're talking to a really friendly audience here, because most of the women who tune in and have, especially the longtime listeners, many are obviously very interested in fertility awareness cycle charting, and many are charting their cycles, obviously not using the specific method.
Right.
We'll certainly link to it. Would you be able to describe kind of in general terms some general guidelines? I know that you did already. And also just kind of that idea of how, let me backtrack a little bit. After leading classes with women for years and kind of getting into it and talking about their cycles and kind of getting into how much they're bleeding, there's this interesting spectrum. So plenty of women who have their periods just fall into what we would, what I understand to be a healthy pattern of bleeding. But there are women who bleed way more. And many don't even, obviously, you encounter this all the time. Many women who bleed way more don't know that that's a thing, because Fiona, you mentioned periods are really personal. And so I always say, you experience your own period and you kind of just think everyone's period is like yours. So you don't really I think that obviously if you're changing your pads and tampons every hour, I think that at some point you would at least consider that that's not how everyone else experiences their period. But just for the listeners, especially the women who tuned in because they do have ridiculous bleeding, what would be some of the signs? And also, I think one of the things I'm curious about is what would be some of those kind of specific signs of bleeding disorder or something else, right? Because are there women who bleed really heavy but don't have bleeding disorders?
Yeah. So, 1 in 5 women actually experience heavy menstrual bleeding, but 1 in about 100 women have what's called von Willebrand disease. So there's an expected 1.6 million women out there who have von Willebrand disease, and many are not aware of it. They're not diagnosed, which is huge. That's the size of Philadelphia. So the first kind of step is really, I think, what your listeners are already doing. It's charting that. It's having this concrete, this is what's happening, on a daily basis during my period. This is how long I'm bleeding, and bringing it to your healthcare provider. So typically an OBGYN, right? But what we find is that sometimes OBGYNs don't necessarily, their training really leads them to gynecological causes. So as you mentioned, the fibroids, endometriosis, those are the things that they're going to look for. And it's possible to have endometriosis and a bleeding disorder. You can have both. But one of the things that we're doing with the Better You Know campaign is really trying to raise awareness among OBGYNs that von Willebrand disease, especially for women, because there's so many that are experiencing this disorder, is something they should be looking for too. So we have an OBGYN specific brochure that kind of leads them through the steps. And it's easy to understand even for women. That's on the betteryouKnow.org website. So you can take that brochure that the OBGYN is going to understand about how to assess this woman for a bleeding disorder specifically, and when to refer them to a hematologist. And a hematologist is someone that specializes in diagnosing and treating bleeding disorders. So that's, I would say, is kind of the first step. I don't believe that your average woman can't really differentiate. There's laboratory tests that are needed to diagnose a bleeding disorder, as there are tests and exams that are needed to diagnose something else like fibroids.
Yeah, and the issue with that, Lisa, also is the lab testing process can also be very complex and confusing for women, because as you know, your test results can also change based on your hormones. So sometimes they have to, keep repeating a test to get their, accurate information that they need. Sometimes, if you're feeling anxious or nervous, and depending on where you are with your menstrual cycle. So what we want people to understand is that there is help and there's great treatment out there, but we need to start raising that awareness and making the conversation much more applicable for all of us to have these conversations with our sisters, our mothers, our cousins. So that's part of also the campaign as well. That's what, Fiona was talking about. And that Better You Know site that we mentioned has some of these there's a guide to a lab testing, which is really great. Again, re-empowering folks so they know what these different tests look like. But that's a great question. we want quick results, right? And we want to know now because we want whatever the situation's happening to stop or to get treatment and also to be validated. That's the other component of it. So, there are some great resources and, we're so excited to be here and continuing this conversation.
Mm-hmm. Well, I really appreciate that. I think that you highlight some really important challenges, obviously. So whenever it comes to issues of the menstrual cycle, many women already struggle to be taken seriously, and they already struggle to get an accurate diagnosis. And so this is so important for women to know that they're, in addition to the common things that their healthcare practitioner would be looking out for already, as you mentioned, like fibroids or, God forbid, cancer or some, an infection or estrogen related hormonal issues. Those are some of the things that the practitioners would be used to looking for. And this presents another challenge. You mentioned a brochure pamphlet to share with the OB/GYNs because they aren't necessarily looking for bleeding disorders, because it's something that if it's 1 in every 100 women, it's obviously still quite prevalent. But if it's not something they're looking for, even if they have patients that have it, they probably wouldn't necessarily identify it. So you mentioned von Willebrand disease. I hope I said it correctly. And to be honest, I wasn't very familiar with it. It was actually a friend of mine, a colleague of mine, who it runs in her family. And so she has a few daughters that have it. And she talked about some of the challenges that they face specifically. So I guess the question out of that is, could you tell us about von Willebrand and also if this is kind of one of the most common bleeding disorders or if there are other bleeding disorders as well?
Yeah. So von Willebrand's disease is where I mentioned at the beginning that, your blood in your blood, there's all these different proteins and platelets that come together to form a clot. With von Willebrand's disease, it affects women and men equally, but women are much more likely to be identified because of the heavy menstrual bleeding. But essentially what happens is that von Willebrand factor protein is either missing, it doesn't function the way that it should, or the body just doesn't make enough of it. So there's actually different types of von Willebrands, and those types can have an impact on what severity you're experiencing. So von Willebrand's disease is definitely the most common bleeding disorder that women and girls experience. But I want to point out that women can have hemophilia too. It's not just men. And there's a number of other bleeding disorders that, while they're more rare, women can experience as well.
And can you just quickly share what is hemophilia for anyone who doesn't know?
Yeah, so hemophilia it's traditionally thought of as a bleeding disorder that affects males, and that mothers are just carriers that pass the gene along to the males, and the males can only have the symptoms because it's passed along on the X chromosome. So males get the X from their mom and the Y from their dad, and females have 2 X's. So it's assumed 2 X chromosomes, it's assumed that one compensates for the other. But we find that that's not always true.
And what are the most common symptoms of hemophilia, just for anyone who doesn't know?
For hemophilia, some of the most common symptoms are bleeding into joints. You can have intracranial hemorrhages. For males, it's really diagnosed most commonly as a very little baby if you have a severe form of the disease during circumcision, where it just bleeds and bleeds.
Okay. And when you said bleeding into the joints, I think that's something that you said earlier. And, it's not necessarily something I'm familiar with outside of my wheelhouse. So joint bleeding, if someone was experiencing something like that, are we talking pools of blood that are happening at what does that look like?
So that's happening internally. So typically it happens in joints like your knees, where you have bone on bone with kind of a sac in the middle that helps with that flexibility. And what happens is that sometimes with that friction, you get blood that pools within that sac. And it can cause your joints to swell up. It causes pain, tenderness, things like that. And if it happens repeatedly over and over, it can actually cause what we call arthropathy. So essentially joint damage in that location.
Mm-hmm. Well, and going back to von Willebrand's disease, so you mentioned and I'm probably going to say it incorrectly, forgive me, the clotting factor. And so it's either you're making it or you're not making it, or you're not making it correctly, or it's not functioning correctly. Could you just repeat that again and just share how I suppose the different ways that this occurs could affect a woman, whether it's through her menstruation or otherwise, and what is kind of typically done about it.
Yeah. So with von Willebrand disease, like I said, there's different types. So either you're not making any of the von Willebrand factor, in which case you're more likely to have more bleeding because that factor protein works with other ones to form that clot, right? To stop the bleeding. So if that's not there to help the others out, that clot is going to take a really long time to form and hold, to really, so that you're healing and it's not just breaking apart and then reclotting and breaking apart. With type 2, that's where it doesn't function quite the way that it should. So it doesn't work together the way that it should with the platelets and the other factor proteins. And then there's another type where you have it, but you don't make quite enough. All of that can affect what your symptoms are. And like I said, heavy menstrual bleeding is definitely the most common, but we do see, especially in children, nosebleeds, just recurrent nosebleeds that go on. And sometimes you have to bring the child to the ER or your doctor because it just won't stop. You're packing it and it just won't stop.
Yeah, it's so interesting to me because when I was a kid growing up, there was always someone in the class who would get nosebleeds and get them regularly and
frequently.
So it's bringing back like not the good kind of flashbacks, but but there was always a kid in the school who just like someone knocks, like just barely touches their face and their nose is just like gushing forever. Yeah. So this is really, I'm sure a lot of the listeners are kind of like, oh wow, like this is really interesting. And also you can just imagine what it would do for a woman who is having a menstrual period if it's not diagnosed and treated. So this is kind of tongue in cheek, but I think it's important to say. So what you're saying is that this is something that is passed down. So it's something that is in the families. It's something that's genetic. It's not something that, eating differently is going to solve.
No.
Right.
So when a woman is diagnosed with this issue, can you share a little bit about how it's then treated? Like what is done to resolve it and to minimize the blood loss?
So treatment is going to vary. And we do definitely recommend that if you think that you are having the symptoms of a bleeding disorder, talk to your primary care physician or talk to your OBGYN, but ask for a referral. If they don't have other causes that they can tell you are causing your symptoms, ask for a referral to a hematologist because it really takes that specialized training, one, for the diagnostic testing, like Jhon mentioned, but two, for the treatment. The treatment is really going to depend on which disorder you have and then what your symptoms are. And sometimes, we kind of come full circle, it's really about that communication with your doctor and your hematologist because there isn't, for women with bleeding disorders, a one-size treatment fits all. So they may start you off with something and it's not quite managing your symptoms, it's not working for you. And it's really important to go back and tell them. Chart it, take pictures of your bruises, document your nosebleeds, document what you think is a joint bleed, chart your menstrual cycle and say, hey, look, I'm not seeing a difference here on this treatment. What else is out there? Because there are different treatments and they may try a couple of them to see what works best for the woman. And it's that dialogue, that it's really important. And it's also important, I think Jhon kind of alluded to this before, and you definitely did, Lisa, to be thinking about not just about ourselves as women, which we tend not to do nearly enough anyways, but also about our daughters and having this conversation about menstrual bleeding and charting their periods and things to see if bleeding disorders aren't always passed on from the mom. It may come from the dad. And so it's important to, be charting if you think your child is bleeding more than they should be during their menstrual period, to be aware of that as well.
Mm-hmm. Well, certainly, I think that knowledge is really important and powerful, especially in an area where even if a woman is going to their OBGYN with full-on symptoms of a bleeding disorder if that OBGYN may not even be aware, focused on it. So I think, obviously, if a woman every client of mine whose bleeding is excessive certainly gets a suggestion to go straight to their doctor. For the listener who's kind of thinking like, oh my gosh, this is genetic bleeding disorder, like, you know what I mean? Like, dietary changes are... So I'm not suggesting that this is something that a woman's going to do on her own, but just so that she would have a sense of like, that there's hope at the end of the tunnel. Would you be able to share some of the ways that this is commonly addressed? Certainly, it's not going to be a specific piece of information for anybody, just general information for how bleeding disorders are handled. I guess the question kind of comes where, if you think about throughout the trajectory of someone's life, if they have to have surgeries or if they give birth, certainly, just to give us a general idea about how it's managed, like when it's caught and the woman is working with her hematologist and she's getting the treatment that she needs and the follow-up, does it stop? Like, does her bleeding regulate? Like, are her periods always crazy, or is there hope at the end of this tunnel?
No, there's effective treatment. There is treatment that is effective to manage the symptoms and get it so that it's not affecting her life. So, Jhon, do you want to talk about why? I've been talking a bunch. Do you want to jump in about why it's so important that women get diagnosed?
Yeah. So, Lisa, you're asking all these amazing questions, and I think what I'm hearing also, not just from this podcast, but our conversations around the country, because we go around the country raising awareness, talking to community members, and talking to folks. We all want a quick fix, and I think I said that earlier.
Well, I just want to say, I'm not trying to like. If for any of the listeners to the podcast, like, that's not what we do here. So it's not about trying to say, okay, you have this problem and you have this issue and it's just going to be easy and simple. I'm more thinking of an overview, because this is something that no one has heard of. And what I know from just the work that I do is that women are just up against it. If a woman wants to come off the pill, sometimes she literally is laughed at from her doctor. So if she doesn't know what questions to ask, what kind of specifics, like, this is just my opinion, so this is like the cross I'll die on, but it's like, if women don't know the specific things to ask for, if they don't have a sense of like how it's treated, what kind of practitioner would be the one to be referred to, then when they're in that office talking to someone who potentially isn't aware of this issue and is actually giving her pushback, it's not a bleeding disorder, I have plenty, she needs to know. So that's why I'm asking these questions.
Yeah, I'm glad you brought up the birth control pill, because sometimes, what we see a lot and what we hear a lot are misdiagnosed, right? Because this is not on that radar. So those brochures that Fiona was talking about is really important for somebody to take a look at it themselves and then also bring to their providers. But one of the most common thing that, most doctors say sometimes is put somebody on the pill, again, a misdiagnosed. So what we want to understand is that what we hear from time to time with women that are getting their diagnosis, it brings a sense of relief and empowerment. And that's that, I think that was kind of like the streamlined discussion here is empowerment and validation. We have an assessment tool that it's an anonymous assessment tool. It's online on the Better You Know website that asks you a series of questions that raises your awareness that at the end, it might, it'll give you not a diagnosis, but it raises your awareness that you might be or might not be at risk for having a bleeding disorder. So I would suggest to go to that site, take that assessment tool. It's anonymous, because what we hear from women after getting their diagnosis, besides the sense of empowerment, they now have a why they are bleeding so much, that they can actually bring to their doctor and have these tools to have that conversation so they can get a diagnosis and then start on a treatment program. And one of the questions that we ask folks, and so there's one of the educational materials that we have that suggests on some type of questions that you can ask your doctor. And one of them is, have you ever treated somebody with a bleeding disorder? Great question to have, right? And that's how we start building that dialogue and building that sense of empowerment for folks. Because at the end of the day, the better you know about yourself and your symptoms and bring these tools to a doctor, the better treatment we can get. Yeah, so that's something that I want us to make sure that we're mindful of as we keep talking about this.
I wanted to jump into today's episode to invite you to join us for the next round of Fertility Awareness Mastery Live. My 8-week group coaching program is designed to help you unlock the secrets of your menstrual cycle. Fertility Awareness Mastery teaches you everything you need to know about using fertility awareness cycle tracking to achieve your intentions. Whether you're trying to get pregnant, avoid pregnancy, or planning to conceive in the future, we've got you covered. This program goes deep. Get to the root of your period problems, hormone imbalances, fertility challenges, and so much more. Early bird registration is now open, but only for a limited time. Head over to fertilityfriday.com/fam to register today. That's fertilityfriday.com/FAM. Now let's jump back into today's episode. Well, and so a few questions. Can a woman's regular OB, like would the woman's regular OB have like the knowledge to do the testing that is required? Because I can sense the hesitancy to share like what testing wouldn't be needed or what specific treatments are given, right? So you're kind of saying, okay, we're not going to talk about that because you need to go and get that sorted out and treated. But for the woman who's in her OB's office, who's had, the testing, let's say like she's kind of pushed for testing for this and for that, and like it's not really showing anything. And so this is kind of like, this podcast is very illuminating because it's like, well, they've tested for everything, but they've never tested me for this. So question one is like, would the regular OB be able to just do that? Would the OB know exactly what test?
The OB would not.
Okay.
And
so then what would the woman ask her OB?
So I think that's also like why that OBGYN brochure, even though it's directed to them, is something that can be a really good tool for a woman who has not been, the OBGYN has gone through their gamut and they're not finding any causes. In the OBGYN brochure, it says, look for this, look for this, look for this.
And can you tell us like what it says, or does everyone have to? We will link it. I'm going to, all of the things we talk about, but just for I just know my audience, it's just kind of like,
no, and we don't,
one or two things that they could ask their OB. Like, would you just go straight to be like, can you refer me to a hematologist or?
No, I mean, I think the OBGYN should look for some of the more routine, if it's their first visit to the OBGYN should look for things that may be more routine. But if nothing's coming up, then they should ask for a referral to hematologist. So, again, a hematologist has that specialty training, and they also have access to laboratories that can do this advanced testing that's not available in your local OBGYN's office or even potentially available for them to send it out to a testing center. And it takes that training for the hematologist to be able to put different tests together for the diagnosis. Unfortunately, right now, there's been a lot of research and a lot of advancement in diagnosing women with bleeding disorders over the last 10 to 15 years. But it still takes someone who's highly skilled. It's not a, yes, you have a bleeding disorder and this is what it is, or no, you don't, unfortunately. And, I think the big message, oral contraceptives female hormones can be one way of treatment, but there's also antifibrinolytics that can be used. If you have hemophilia and you have severe hemophilia, and you have all these symptoms, there are medications specifically for that. And with von Willebrand disease, there are medications specifically for that. But there's also, like nasal spray and tablets that can be used to help your blood to clot better. There are treatments available. It really just depends on what you have and what's appropriate for you, because you don't want to give yourself clotting factor and then have a blood clot, which is why we don't want women treating themselves at home.
Yeah. And
you really
Lisa,
should be under the care of a hematologist.
Yeah.
But, it is, there are a lot of women out there that are dealing with embarrassment, depression, anxiety. They're missing work. There's difficulties. They're missing recreational activities. It can really create this cycle of isolation and difficulties with intimacy with a partner. I mean, there's a lot of psychosocial aspects to this And then not to mention potentially life-threatening hemorrhage during childbirth or miscarriage. And the other end of that scale, women having unnecessary surgeries like hysterectomies because they just want the bleeding to stop. Yeah. They cannot deal with it in their lives anymore. So what we really want people to realize is bleeding disorders are under-recognized as a cause of heavy menstrual bleeding. And if you don't have another cause, get a referral to a hematologist. Yeah. There are places called hemophilia treatment centers, and they don't just treat hemophilia, they actually treat all bleeding disorders. And then there's also specialized ones of those that are specialty for women, and they're located in every state in the United States. So there are places that you can go to get diagnosed, to get treatment. And then that kind of constant dialogue with your hematologist about what's working, what's not working, to really find what's best for you so that you're living your best life. And these things that may have bogged you down for years are no longer doing that.
Yeah. And Lisa, one of the things I think you asked also earlier was about some of the questions, right? And on that site that we were talking about, there's a doctor visit preparation guide, and that goes a little bit over some of those questions. So just very, 3 quick questions is, one is, what do you think might be the underlying cause of my symptoms, right? Just starting that conversation there. Or how can I manage my pain or symptoms while I'm waiting for a diagnosis? So these are different questions that's going to raise awareness for the provider and also empower, yourself. And then another quick question that can also be asked, and these are all listed there, is there anything I should do to prepare for a lab test? So we want people to, this guide is also catered for people to start creating their own questions as well. It's just a guide to have that conversation. So as Fiona was talking about, we can get that better treatment, we can get that better care, because it's not just affecting our physical health, but our emotional and mental health as well.
Mm-hmm. I'm so glad that you've created these resources, because it's just so unfortunate that it's so hard for women to get adequate care related to menstrual cycle issues. And I'm so glad that we're having this conversation today. Fiona, all the points that you went over, and Jhon as well, it really paints an excellent picture of how, for any woman who's concerned, who has been tracking her cycles and who's tried everything to figure out what's happening with her excessive bleeding, this really points to what to do. So I feel like knowing that really going to a hematologist, asking for a referral to a hematologist who specializes in bleeding disorders, can be kind of the way that you get the answer to this question. I feel like so many women who are listening to this are just finally something additional that we can do. Because the one thing that I truly believe, women are savvy. They have to be in order to get the care that they need. And when you have a condition that is not just not something that is common, it can take years to get a diagnosis. So I think what the two of you are doing is incredible, and also it speaks to something that I think we've mentioned on the call, but one of the questions I want to ask you, I don't know if there's an answer to this question. Why is it that this is not a thing? After you listen to this podcast episode, it's going to seem so obvious. Duh, of course, if I have excessive bleeding, I could have a bleeding disorder. Why didn't I think of this before? But obviously it's not. How is it that you can have an OB or, practitioners that are specializing in women's health issues that don't, is it that it's not taught? Is this the same? Do I have to add to my rant about people not being taught fertility awareness? What is going on?
All of the above.
Yeah, I think these are great questions. And this is why NHF started the Better You Know campaign. And we're targeting women and trying to arm them with as many resources as they can, we can, so that they can go to the doctor and say, hey, you know what? I looked at my history and I think I have a family history of bleeding disorders. And I had a lot of nosebleeds as a kid. And, I have all of these other symptoms and I have heavy menstrual bleeding. Look at my menstrual chart. And then simultaneously working with the OBGYN providers. Dentists are also another big one that can identify bleeding disorders. because it's not taught in medical school. It's not something that's taught as like, hey, this should raise a red flag for bleeding disorders. But it's something that we believe they should be much more aware of. And so we're working to try and help that.
Can I just ask, so when you say it's not taught in med school, do you mean that with, in relation to women's menstrual cycles, or do you mean like at all? Because it can't be at all, right?
I think there's very, very little that's taught in medical cycles or medical schools about bleeding disorders in general.
Yeah, it's not. So it's not in depth as it should be, right? So I mean, this is a complex issue, right? So from like family history and just the whole thing that we hear often, it's like, oh, I come from a family of bleeders. My grandmother's a heavy bleeder. So there's the personal, but then the bigger issue, the other issue is also our medical school system is not giving the right type of education or as much. Also, we're learning a lot more, right? Where we are now with bleeding disorders, very different than where we were 10 or 15 years ago. And, something great for your listeners and for yourself to look at is also the history. There's so much, not just misdiagnosed, but stigma with the history of bleeding disorders, especially throughout the history of the 80s. There's so many layers here, so many complex layers. But again, it's raising that awareness, not just for us folks, but also raising the awareness for providers and all providers, not just OBGYN, but as Fiona was saying, dentists, right? That's like one of those like duh moments. Yeah, of course. But, that's not in our foremind, as we think forward.
And I know Jhon has told me stories about women where, it was their gums bleeding. That was the impetus for going to seek specialized care.
Well, the audience can't see my facial expressions, but the two of you can. So I'm just going to say this thing and then we can move on. But, for all the years that I've talked about fertility awareness charting, cervical fluid observation, and complained, why don't they teach this in medical school? At least it's not life and death. What is the excuse?
No,
Sorry,
I mean,
I just had to say that because I'm thinking like you're saying that they get trained very little in medical school. So it's not even the doctor's fault. And I think this is why it's so important, again, to have these conversations, because you don't want to go into your doctor's office all, like pissy and like as if they did something. If they're not trained in a certain area, or they don't specialize in a certain area, or the actual training in medical school kind of just barely goes over, it doesn't go over in depth, you can't expect your OB to be a hematologist. But certainly this is a big issue. And I think what I appreciate about what you're doing is by the handouts and information that you've put together, it's funny because I do this in a similar way, except it's like not for bleeding disorders, but it's like, okay, you need to talk in their language. So you need to tell them that you have a family history, and you need to tell them that you had nosebleeds, and you need to basically justify your case in their language so that they understand that there's a justification for this referral. And that's how you get support.
That it really is. It's kind of knowing how, if you go into your doctor and you say, you know what, I bleed a lot. They're not going to understand what that means for you. But if you go in and doctors speak a different language. And so if you go into them and say, hey, here are my facts, here's my data, here's my evidence, with my menstrual chart, with my doctor preparation guide, where you've thought about your history, you've thought about your history of symptoms, and you can go into them with that, you're so much more prepared, and they're going to listen. They're going to be able to listen to you because they're hearing what you're saying in the language that they speak.
Well, and can I add something to that? Because for all the listeners who are kind of thinking like, well, I went in with because when you say chart, they're thinking like their fertility, like you're thinking of the standardized chart. And so I tend to try to stay in the head of my listeners. But for the listeners who chart in their menstrual cycle charts, I feel like it would be helpful potentially, so correct me if I'm wrong, as a starting point to go with specific numbers, quantities, frequency. So how frequently do you change your pad? What size of pad? How frequently do you change your tampon? What size of tampon?
What was the size? Was it the size of a grape, a strawberry?
Exactly. And then if you track, and it doesn't have to be perfect, but a lot of women use menstrual cups, or you can, I had a guide from a research study of like a general 5 milliliters of bleeding per regular tampon. Like so I'm not talking about scientific here, but if you can have a general gauge of the total amount of bleeding or the amount of bleeding per day. So when you bring factual data like that, even if the doctor doesn't want to look at the chart because they're kind of like, oh, that's airy fairy dust, this fertility charting. Sorry for all the OBs that don't feel that way, but certainly I have some clients who've had a negative experience, which is why I said that. But anyways, you can see what I'm saying. I'm saying like go with facts and data. That's probably the way to talk their language.
That's the way to talk their language. And also, I mean, the better you know menstrual chart, it is validated. So you record on this day, I used this number of small tampons, this number of regular or of large, and it gives you different points for that. I had this number of blood clots, and then you do it every day. So it shows the number of days you had a period. And again, 10 days is too long. There's a cause to that. And it also shows the amount of blood loss. And NHF and CDC have done it together.
Very official.
And CDC has worked with NHF through a cooperative agreement, and CDC has its logo on NHF's menstrual chart, which can also help.
Official, ladies.
It can also it can help. That can help.
Okay, so
we stand by that menstrual chart.
Yeah, no, I'm so happy that this conversation is like infuriating me and also bringing me joy like at the same time. And I'm sure it's the same for you.
Yeah. Lisa, can I just jump back for one quick second? I just wanted to say bleeding disorders are still considered relatively rare, even for women. So we can't, it's a double-edged sword. We can't expect medical schools to go over absolutely everything in the depth that they need to. That's what we have. That's why it's so important to get referred to the specialists who do go into depth in those things.
Mm-hmm. Well, I think that's generally sound advice for pretty much anything. There's a big difference between, not to put anybody down, but if you think about it, different practitioners have different roles. So I always use silly examples for everything, but just like I'm not going to go into McDonald's and ask them to change my oil, you don't go into your GP and ask them to have a full-on specialization in hematology. It just doesn't make sense. But the key for the patient perspective is if you have information that there's such a thing as a hematologist and you could have such a thing as a bleeding disorder, then it empowers you to at least ask so that you can get the test and have it ruled out.
Yeah.
So one last kind of question / topic that could be the whole podcast. So I'm just going to put that out there, but I do want to ask about it. We touched on hormonal birth control. So could you tell me or tell the audience, I suppose, how do I say this? It's kind of a loaded question, but what are some of the potential benefits and challenges if a woman, for example, is put on birth control for bleeding and, then the diagnosis is missed, does the birth control pill fix, bleeding disorders? But share with us some of the benefits and potential problems with that as the solution.
Okay, Jhon, I'm going to take this first and then you jump in, okay? So female hormones can definitely be a treatment for bleeding disorders. There is no, there is no cure. So it's really the treatments that are going to effectively manage, your symptoms over the course of your lifetime. And the female hormones do work for women to prevent that endometrial lining from shedding as much and from building up and shedding. But, if you want to get pregnant, those aren't going to work. You're not going to be able to use that as a bleeding disorder treatment and get pregnant at the same time. So that's why it's really important to have that hematologist where you can talk and that hematologist work and collaborate with your OBGYN. That collaboration cross fields is important too, especially if you're thinking about getting pregnant so that they can work together for you. But, we've definitely heard horror stories where, a woman got off birth control or, stopped taking her female hormone because she wanted to get pregnant and then bled for 264 days out of the year. And that's not necessary. That shouldn't be happening because there are other treatments available. So again, treatment specific is going to depend on your disorder. It's going to depend on your symptoms. The female hormones can be very useful to help get heavy menstrual bleeding back to quote unquote normal menstrual bleeding, where you're only losing that 2 to 3 tablespoons of blood during your period, and your period's lasting less than 7 days. But if you're experiencing other symptoms like nosebleeds, joint bleeds, things like that, then you need a different treatment, or you need an additional treatment.
Right. Yeah, and a treatment that's actually going to solve and help solve the issue at hand. Again, as we mentioned earlier in the podcast, is that sometimes going on the birth control pill, it prolongs, and it's a misdiagnose, right? So that's just prolonging the amount of time that you're actually going to be able to get, the proper diagnosis and then the proper treatment.
I thought of a follow-up question. So for women who are legitimately on the pill right now because their bleeding was so excessive, that I've heard women say that if I wasn't on the pill, I'd probably be dead or something like that, because I bled so much that they thought I would bleed out if I wasn't on the pill. So obviously that would be a situation where a referral to a hematologist would be appropriate. Yeah. But the question is, if you're on birth control now because you had an issue like that, is it possible to go to a hematologist while on the birth control pill and get a diagnosis while you're still taking that contraceptive hormone replacement?
It would be important to talk to the hematologist about whether or not it's right for you to come off the pill before they do the testing. That would be a call that a clinician would make.
So if a woman is on the pill, she could then still conceivably go to her OB, get a referral for a hematologist, have that conversation.
Yes.
So it would still be worth having that conversation. It wouldn't be like you need to go off the pill, bleed excessively, and then go. Obviously, that doesn't make sense, but I just want to say that because there's potentially women who are on the pill for that reason who tuned into this specific podcast episode to learn more about possibilities like that, who would need to know, like, what do I do? Because I can't just come off of the pill because this was such a big problem for me.
Absolutely. And I love the way you phrase that. That's really important. Yes, the message is we want you to live a healthy life as much as possible. And, with empowering yourself with knowledge and going to see that hematologist, even if you're on the pill, and they will direct you, and look at your history, and, think about the different types of tests that they're going to do, and therefore they are going to be making that decision. But yes, please, please, please go get the care and see the right type of doctors to help get the best type of diagnosis possible.
Well, this has been incredibly informative. Before we kind of wrap up today, thinking about everything we talked about today, is there any other kind of messages or any other kind of important details or wrap up information for the women listening that you'd want them to know? And of course, I will ask you at the end to share, because I want you to go through all of the resources. But before that, are there any other kind of last messages you want to share with the listeners?
I would just say that as women, we tend to really kind of take care of everyone around us and kind of leave little in the tank for our own self-care. So this is one way to really take care of yourself, to get at, the cause of what's causing your symptoms, so that, you can get treatment. Treatment is out there, it's available, it's effective. And if you have a bleeding disorder, it's better, it's better if you get treatment, you will feel better. And if you feel better, then you're going to have the time and the energy to be your best self with everybody else too.
And
Jhon, anything you want to add?
Yeah, that sums it up beautifully. And if you going back to the name of this initiative is The Better You Know, right? So the better you know about yourself, your symptoms, and treatment, and knowing that there is better treatment out there, and to help with better care and quality of life. So the better you know, the more you empower yourself. And also, I ask, start having these uncomfortable conversations, within your family and within your friends, because all of us need to be part of this movement to help raise awareness and start creating better dialogue.
This has been incredible. I can just imagine how many women, this is like a breath of fresh air, like someone's taking this seriously. Like I always knew something was wrong, but I didn't know where to go. Like I can just imagine it now. So on behalf of all of us, in the Fertility Friday community, thank you for doing what you do and for spreading the word and continuing to shout from the rooftops. I mean, even though it's, as you mentioned, like still kind of a rare thing, you also mentioned, I think 1.6 million women, like that's a huge amount of women that are dealing with this and potentially not getting the support that they need. So share with us, go through again, the name of the organization, the website, where we can go to get that information. And of course, I will make sure to link all of those resources in the show notes page for today's episode.
Very easy. And you will all remember it's betteryouknow.org. That's where you can find the assessment tool that will raise your awareness if you're at risk or not. We've got that doctor visit preparation we were talking about, healthcare diaries, lab test logging, menstrual chart logging. We got it all there. But there's also this great brochure about it's a teen girl brochure. And this, I give this to my friends who are parents, and it's more about for them because it really starts explaining from a basic understanding of how to start having these conversations. So that's one of our favorite ones because that goes by really fast and people love it. We also have the lab testings that we talked about, and then the two provider ones, one specifically for providers and then one for OBGYNs, all in PDF form, betteryouknow.org, because the better you know, the better lives that you can create and live.
Well, and I just wanted to ask you have the two resources for practitioners. Do you have resources or training for practitioners regarding blood disorders, bleeding disorders?
Yeah. So we just had 3 accredited webinars that non-hematology providers, so OBGYNs, health, primary physicians, dentists, were available for them to get accredited to learn more about von Willebrand disease and also women with bleeding disorders. But just going back to the better you know, I just wanted to also point out, like Jhon said in the beginning, these are available in English and Spanish. We want people to be able to use these. And there's also 10 great videos or 8 great videos where 10 real women talk about their experiences living with a bleeding disorder. And they share what it was like, living with the symptoms and their journeys between the onset of their symptoms and diagnosis, and just the empowerment and sense of freedom that they gained from their diagnosis and what their life is like now with treatment. That's our other resource that I just wanted to give a shout out because it's moving.
Mm-hmm. Well, there's nothing I feel more powerful than hearing the experiences of real women, giving them a voice so that we can know what this is really like, what the challenges that they're really facing are. And especially beneficial for any women who are listening right now who have gone through that to know that they're not alone. And this is something that can be treated, can be diagnosed. And so I really appreciate both of you for being here today and just filling our minds with all this information, blowing our minds as well while you're at it. So thank you so much for being here today.
Thank you. And thank you for the work that you're doing and helping us, raise awareness and for bringing us along. Truly appreciate your time and your wisdom. So thank you.
Yeah, it's really been our pleasure to talk with you today, Lisa. Thank you so much for having us on.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/356. I hope that you enjoyed today's episode. Certainly I found this conversation to be extremely informative. So many important pieces of information to take away. I think the first thing to take away is that, of course, every single woman with heavy menstrual bleeding doesn't have a bleeding disorder, but certainly there are specific signs and symptoms that should ultimately be investigated. And so I feel that what came out of today's episode is to really, if you have been struggling with excessive bleeding for a long time, if you have been put on hormonal birth control because you had such heavy bleeding that, your medical practitioners were concerned, and you have never been screened for a potential bleeding disorder, this episode contained a ton of practical information for how to get that process going. And so first and foremost, tracking your menstrual cycle is key. So many of you who are listening are already doing that. And so adding in the specific tracking to really outline how much bleeding that you have. And I would say it's more important to record as much data as you can rather than to try to be hung up on the specifics. It's very hard to, of course, measure the absolute specific amount, to the milliliter of bleeding that you have, but understanding how to track, how many pads you soak, what size are those pads, how frequently you're changing the menstrual cup, having a general idea of how much bleeding we would say, is in a regular sized pad or tampon versus a super pad or tampon, anywhere from 5 to 10 or 12 milliliters of bleeding, depending on the size, how many times you're tracking that throughout the day, understanding generally how much blood there is in menstrual cup and really tracking that. And also, it's always important to understand what's normal and what's not normal. And so, what the research tells us is that a normal menstrual period should be anywhere from about 25 milliliters, on the low end to about 80 milliliters on the high end. That amounts somewhere between, 1 and 4 to 5 ounces of bleeding throughout the whole course of your menstrual period. And so there are women who bleed less than that and women who bleed more than that. Of course, that falls outside of the range. Some practitioners have gone so far to say that maybe 60 milliliters of bleeding should be on the top end. But certainly there are many women who bleed much more than that. And so just having that general sense, again, when you're looking at the menstrual cycle as a vital sign and you understand that every vital sign has a range of what we would consider to be normal. And when the range is outside of normal, it doesn't tell us exactly a diagnosis. So having heavy bleeding in and of itself does not give you any type of diagnosis. But knowing that it falls outside of the normal range and then making sure that you push to get it investigated. The frustrating, honest reality is that if you do have menstrual cycle related issues, it's often up to you to really push to get those, the correct diagnosis, to get the support that you need. It's just unfortunate, but it is what it is. And so I think the important points to remember are you can't necessarily assume that that's what it is, right? You can't just assume that's what similar to anything else. You can't just assume that it's the worst possible thing. But at the same time, any type of consistently heavy, excessively heavy bleeding, it does warrant an investigation. And I feel like that's a huge, huge takeaway. And even knowing that, I believe that what Fiona mentioned was, 1 out of every 100 women has this condition. Well, if you think about how many millions of people there are across the world, that means that there's a lot of women that actually do have undiagnosed bleeding disorders that are kind of walking around living their lives, many of whom may have been put on hormonal contraceptive as a way to mitigate the bleeding during their menstrual cycles. But of course, if it's undiagnosed and they're going into pregnancy, labor, delivery, surgery, there's a lot of concerns with having an undiagnosed bleeding disorder. So certainly check out the resources that Fiona and Jhon were talking about and discussing. Those will be on our show notes page. So you'll find that over at fertilityfriday.com/356. And we'll make sure to link all of the information, the handouts and everything that they were talking about. But yes, I was certainly thrilled to have this conversation and to be able to share this conversation with you, just to really keep that conversation going. You could hear the fire, I'm sure, in my voice because, I'm already fired up about the lack of knowledge and information that is available for women about fertility awareness, about the menstrual cycle. And of course, that is why I keep talking about this issue and doing my best and doing my part to raise awareness. But to learn about something like bleeding disorders and to discover that many healthcare practitioners haven't necessarily had a lot of training, aren't necessarily looking for that when women are coming into their office, and knowing that it could be life-threatening depending on the situation is very kind of jarring and alarming. So if you know of any women who could benefit from hearing today's episode, friends who've talked about their bleeding and talked about how it's like a crime scene or it's completely ridiculous or they basically can't go anywhere because they're bleeding through multiple pads and tampons. Again, it's not necessarily a bleeding disorder. We can't assume that everyone that has heavy bleeding has a disorder. It can be related to a number of different issues. But certainly, if you know someone who has been struggling with this for a long time and they have really not been able to get to the bottom of it or improve the situation, then certainly at least an assessment is warranted. I feel like better be safe than sorry. It's always better to go and get assessed and have it ruled out than to just kind of assume everything is fine. So with that said, I hope that you have a wonderful weekend whenever you are tuning into today's show. And of course, as always, until next time, be well and happy charting.